psychology and prevention science, and I co-direct the Durham Connects program. It started in Durham, and now they're starting to grow nationally. But I wanted to talk about what we've learned over the past 6 years about sort of identifying and addressing postpartum needs of mothers in this early period. So as we've heard a lot today, the days and weeks following the birth of a child are certainly a time of significant transition and often stress and vulnerability. And the thing that I really want to highlight is that at this time of vulnerability for the family, the burden falls primarily to families and to the mothers themselves to go out into the community to secure and receive the support and care that they need during this postpartum period. In a lot of Western nations, and by that I mean countries in Europe, Australia, New Zealand, they utilize home visiting as a way to help reduce this family burden during this period by bringing support and care to the family. And in fact, the World Health Organization has actually recommended that all nations adopt home visiting as part of routine postnatal care. So for all you mothers out there that might be wondering, where was my home visit? In the US, home visiting is becoming an increasingly popular approach to helping families, but currently most federally funded programs are only offered or available to low-income families. And they're typically long-term intensive services programs like Nurse Family Partnership that came up at lunch. And these are very good programs, and I don't mean to slight them in any way. But we believe that if your goal is really population health and improving outcomes for all mothers and babies, that offering home visiting services to all mothers is necessary, both to understand the full extent of need in a community, both met and unmet, as well as to improve health and well-being for mothers and babies for the entire population. So the way that we've approached population health, just very brief, simple explanation of Durham Connects. So the program is 1 to 3 home visits with a registered nurse, typically between 3 and 12 weeks of age, although there is flexibility around that depending on mother needs. So the nurse comes to the home. The first visit is approximately 1.5 to 2 hours long. And the nurse is available to answer any questions that the mom might have about her own well-being or the baby. And the nurse offers support, what we call supportive guidance or education to all families about topics like feeding and safe sleep that are common to all families with new babies. But then the core of the model is really this, both a comprehensive physical health exam for mom and baby, and these are equivalent to the kind of health exam you would get in a physician's office, and an assessment of family risk and need in 12 factors that we know are linked through research to mother and infant health and well-being. These are in the broad areas of mother and infant health and healthcare, parenting and childcare, family resources and safety, and mother's own well-being and social support. And then to the extent that risk or need is identified, the nurse is able to either provide direct intervention and support to the family for more minor needs or for more significant needs, work with the family to get them connected to matched community resources to provide longer-term support. So what have we learned about the needs of moms? I think the first thing that we really like to underscore is that all families have needs in the postpartum period. We like to say that having a baby is a risk factor. And in fact, 95% of the moms that we see, and again, this is all moms, over 10,000 that we've seen since 2009, have some level of nurse-identified risk or need. In terms of what we see with moms, just a couple of the frequent flyers that come up, and these are very common that we've already heard about. Moms often don't have a good plan for taking care of themselves. So 1 out of every 5 moms that we see at about 3 weeks of age don't have their 6-week postpartum health check scheduled. And among those that do, there are a fair number that had it scheduled and have no idea when it is. And over half of moms report that they don't have a regular medical care provider. So they're currently seeing their OB, but they don't have a standard medical home to connect to provide for their longer-term health needs. A couple of other issues that are common, postpartum depression, so about 1 in every 3 moms that we see have at least mild depressive symptoms, reports of spells of crying, feeling overwhelmed, and about 12% actually have a screen positive for postpartum depression. Breastfeeding, another common topic. About 1 out of every 4 breastfeeding moms that we see are reporting some level of challenge or concern with their breastfeeding experience, which I think is again, consistent with what we've heard today. So the good news is that we think that brief home visiting programs like Durham Connects can play an important role in improving health outcomes for mothers and babies in this postpartum period. First and foremost, by bringing healthcare and support to the mom in her home, rather than mom having to go out into the community. But we also, again, assess a wide range of possible family needs, including the physical environment, which is much more difficult to assess in home or in a doctor's office. We're successful in reaching a large percentage of the population. About 60 to 70% of eligible moms complete the program on average. Moms really like the program, and we have multiple randomized controlled trials that show that the program is successful in improving mother and child health and well-being. So that's the good news. The not so good news is that home visiting, as we know, is not currently accepted as a routine part of postnatal care in this country, and that makes it very difficult to establish and sustain these programs. This is not a service that is currently reimbursable by private health insurance. And another concern that we have, or another issue, is that home visiting programs, Durham Connects, but also many home visiting programs, are external to medical care providers. So there's not a direct connection between that home visiting program and the regular medical care providers. And we think that that limits mothers' knowledge or awareness of these types of services. And we think that we could improve reach if it were a more normalized or expected part of postnatal care. And we also think that with formal links to medical care providers, doctors could utilize this wealth of information that we collect to be more knowledgeable about mothers' health issues and provide higher quality care. So in terms of next steps for consideration, we sort of thought of a couple different approaches. The first is to expand existing services within our program to address unmet needs that we've identified or that we've discussed today. So testing whether offering new or expanded services improves health outcomes above standard of care as usual, and what Durham Connects currently does. And I think the great thing is that universal home visiting provides a very nice vehicle for addressing a lot of the concerns that are posted on the wall right now. And so we'd love to have the opportunity to do that. And then the other, I think, really encouraging possibility or promising possibility that we see would be formally connecting home visiting and primary care in order to better serve mothers and families. So we could look at whether physicians are more knowledgeable of mothers and provide higher quality care if they had greater knowledge of family risk and the home environment. Thinking about sort of turning the arrow the other direction, how could home visiting be utilized to better support primary pediatricians and primary medical care? So could home visiting be utilized to help follow up on needs that are uncovered by physicians? So in our counties of Eastern North Carolina, for example, we do routine weight checks for pediatricians so that the mom doesn't have to worry about coming back into the doctor's office, or breastfeeding support would be another. And then again, this idea of would making a formal connection and having physician endorsement of home visiting increase mothers' utilization of these home visiting services. So 12 seconds over, not too long.